Well, this was an incredibly important week for NCDs, including cancer. As a follow-up to the work that was achieved through the UN Summit last year in September, the World Health Assembly sat this week to discuss how do we take those commitments that member states made from around the world and convert them into real, meaningful targets for the future. Targets that we can share with the world to say we're serious about NCDs and cancer. And so this week was very important because the biggest killer of the world's population was at centre stage, and 193 member states committed to reduce the deaths from NCDs, the premature deaths from NCDs, by 25% by 2025. And that is a pretty amazing event, and I'm delighted to be part of it. The next step is about keeping the pressure on member states. There's no doubt that if we don't keep pushing them to follow through on their obligations from last year and the decisions they've taken this week, then unfortunately it will probably wither away. So the role of civil society, the UICC, its colleagues in ACS and around the world is to make sure that member states follow through on those promises. And what's the key promise? Well, in addition to the 25% by 2025 target that we've now got agreed, we have to get 9 more targets on the table. Targets that cover tobacco, salt, obesity, physical inactivity, and probably the most important thing that people really do want to know about is essential medicines. Because a lot of the targets that are presented at the moment are about the risk factors, but we know there are millions and millions of people today who are affected by NCDs who want access to the essential medicines that make a difference to their lives.
Great, and so how did this important victory come about? How did it happen?
Well, I'm a great believer in teamwork, and you have to plan a long time to get a victory like this. This doesn't happen out of the blue. If you go back to the last 3 or 4 years, what you've seen is a group of member states through the Caribbean countries, civil society through the NCD Alliance, great organisations from cancer and diabetes in different countries, press, the World Health Organization, the United Nations, to have a commitment to NCDs in a similar vein to the way they put together a commitment for HIV/AIDS at the beginning of the century. And that's 4 years hard work and a lot of teamwork. And I would say that what you've seen over the last 9 months is a result of that work. But it's about every single day making a commitment to ensure that politicians, the United Nations, the World Health Organization and others recognise that when we start talking about NCDs, it's not theoretical. Because every day, millions of people are either dying of the diseases or they're having to be treated for those diseases. So we have to make it real for them.
So did you want to, and this is up to you, but did you want to call out any of your partners in particular, such as Princess Dina and others that came here in April?
Yeah, well, let me give you an example where there was great teamwork. We were very fortunate to be asked by the US mission here to pull together a meeting of minds of other missions in Geneva, plus the private sector, plus other NGOs, to talk about the issues that we've been discussing this week. And it just shows the power that we have within UICC and the commitment we have from our members, that within a matter of 3 or 4 weeks we were able to bring over John Seffrin, the CEO of the ACS. We had Princess Dina come in from Jordan, and we had our president, Eduardo Cazat, flying from Argentina. And the 3 of them spent 2 days solidly talking to individuals who would affect the decision that we've had this week to convince them that we need 10 targets, and in particular we need to have a global goal to fight cancer and the other NCDs, 25% reduction by 2025. And that was great teamwork. 25% reduction in premature deaths from NCDs by 2025 is an incredible statement by our generation. It's the first time that we, my age group, have said we're going to take this seriously. And so next weekend when I see my children, who are 17 and 15, I can give them the news that our generation has made a commitment to reduce their chances of dying from cancer. And no generation before that has made that statement. So I'm really proud of what we've achieved today.